Thank you very much, Mr. Kilmeade. President Obama is set to play his last hand when it comes to health care later today. He will reveal final revised pieces of what he would like to see going forward.
And in a video response, Illinois Congressman Pete Roskam wonders where or what happened to bipartisanship.
I told the president at the White House summit, the Senate bill that he has basically taken up is like leftovers that they've popped into the microwave, pulled out, given some sprinkles of salt and pepper, tossed a few Republican breadcrumbs across the top, and now put it in front of the American public and say, ooh, isn't this good? Don't you like this time? I think the public is really tired of this, and they don't want these leftovers. They want a fresh start.
Wow. Interesting cooking analogy. Congressman Roskam joins us right now. Good morning to you, Congressman.
Hey, good morning to you both.
I didn't know you were so talented in the kitchen, but let's see how you are on health care when we're not using the cooking analogy and these 4 policies now being considered, the Republican ideas by President Obama. I know you used to work side by side with him in Illinois. Do you like these ideas?
Look, I think that they're gestures, but that's all that they are, really, is gestures. When the president and I served in the state Senate together, we took up some very controversial things, and I saw the president in some ways at his best in terms of bipartisanship, and we were able to negotiate some very comprehensive and very controversial changes to the Illinois death penalty statute. Now, in that context, it was taking on a highly emotional issue, but it was truly bipartisan, and we were able to pass those things unanimously. And that's very, very different, as I told the president at the health care summit. The premise of this negotiation is essentially, hey, what's it going to take for you to vote for my stuff?
Right.
And ultimately, I don't think that's really serving the public that well.
Well, he sent a letter, as you know, Congressman. I got a copy of it right here to the leadership over on the Republican side and on the Democrat side as well yesterday. And he outlined the 4 things that he heard at the summit you just alluded to. He would like to, and these are GOP ideas, engage medical professionals to conduct random undercover investigations of health care providers that receive reimbursements from Medicare or Medicaid and other federal programs. He's also open to including an appropriation of $50 million for additional grants, and I think that is to look into malpractice. If Medicaid is expanded to cover more people, we should consider increasing doctor reimbursement. He says he's open to that. And the final item, I believe that high-deductible health plans could be offered in the exchange under his proposal. Okay, so he sat there, he listened, he's taken 4 of your ideas. Are any GOP going to go to his side?
I highly doubt it. I think that the country has listened and listened and listened over the course of this past year, and you got to give the American public credit. They are tuned in and they fundamentally understand what's going on. I think the president is sort of parsing. Yeah, he heard some of those things talked about, but what he doesn't answer is really the overwhelming criticism of this massive takeover of health care, the lack of choices that's going to result in Americans over the period of time as it relates to their physician choices and other things. And look, even the Medicaid piece, which I directed comments to the president at the health care summit, it's welfare. This is the expansion of welfare that is the foundation upon which he proposes to expand coverage. So I think the public overwhelmingly has said, we understand what's in this bill. Okay. You could put all the window dressing you want on it, but at its core, it's a flawed idea. And instead of doing a massive bill, here's the challenge. Take one of those pieces, if that's bipartisan, and move that piece. Move the waste, fraud, and abuse piece. Great. Do a little bit on the tort reform piece. Great. Sure. But don't do this big, massive bill and tell us it's bipartisan.
All right. You would rather have it piecemeal, to use another cooking analogy. Representative
well
Peter
done.
Roskam.
I sure would.
That's we're going to wrap it up today. Thanks so much for being our guest.
Thank you.